First of all, let me welcome everyone to this press conference. My name is Ray Jones. I am the Pike County Judge Executive. This is the first press conference we've had to update the residents of Pike County on COVID in some time now. We had made quite a bit of progress with vaccinations. The COVID numbers fell precipitously after January. We started seeing a peak, the virus peak in November, December, January, and it was very alarming. As the vaccine rollout became more prevalent, we saw those numbers fall. Now we're seeing a surge here in Pike County, and it's predominantly the Delta variant. We have several people here today that want to give us an update. Now, first of all, let me say this. It's not our intention to put a mask mandate in place. It's not our intention to mandate vaccines for anyone. But it's alarming how much misinformation about COVID is out there, particularly on social media. Earlier this week, I had a conversation with Ms. Tammy Riley, who is the Pike County Health Director, and we discussed it with Dr. Foddy, and we felt it was time to update the public. What you're going to hear is that most of the increase in COVID cases, most of the hospitalizations, most of the people who are requiring mechanical ventilation are unvaccinated. And people are dying needlessly. And we want to make sure that people have accurate information. I had a Facebook friend post this week that they had the vaccine and they had a magnet that was stuck to their arm. Some of you know my wife's a board certified family physician, and she had a patient that asked her about whether there's a microchip in the vaccine. A lot of this information has been put on Facebook, and it's killing people. And I think it's important that people hear from physicians. These are not TV doctors. They're not political pundits on a cable news network. You're going to hear from two board-certified infectious disease experts, Dr. Ferris Cotter, who is the chief of infectious disease at the ARH Healthcare, for the entire ARH Healthcare system, all the hospitals, and including Tug Valley ARH, which is one of the two hospitals here in Pike County. You'll also hear from Dr. Foddy Alacross, who is the chief of infectious disease at Pikeville Medical Center. Dr. Alacross has been on almost every press conference we've had. We've also have our county attorney here in Commissioner Ronnie Robertson, Commissioner Brian Booth, and Commissioner Jason Tackett. And we're all here today because we're all concerned about this. I'm concerned about it because I have 3 children, 2 of whom are fully vaccinated, but my 7-year-old is not. And it is concerning because we're starting to see younger people more seriously ill than what we were seeing last year. I think the doctors will bear that out. But before we start, I want to ask Tammy Riley, who is the Executive Director of the Pike County Health Department, to come up and just give us an update on the numbers and what we're seeing statistically. And then we'll bring the physicians up. If the press has any, if you have any questions, or anyone in the audience has any questions, please let us know, and we'll try to get those answered, because right now is the time. I don't, and I'll grab my phone if you'll put something. We've got people from Pike TV here. If any of the members of the press, or if anybody wants to ask a question by posting it on Pike TV, we have 2 world-class infectious disease doctors who live here, who are raising their kids here. And they can answer those questions to try to let people know what the truth is. And that's all we can do, is tell you the facts, give you the truth, and then people can make their decision whether they're going to get vaccinated. But what they're seeing, not just here, but across the country, is that it's the unvaccinated who are getting really sick, and that the disease is spreading through. So at this time, I'd like to ask Ms. Tammy Riley to come up and give us an update on where we are here in Pike County.
Thank you, Judge Jones. I'm going to atypically step out of the box and provide a very brief personal message before I get into the specifics of the local data as it has been reported to me and the staff at the Pike County Health Department. Now, as we all know, Pike County is a small community, and I've lived here my entire life, like most of you. And if I don't know you, I probably know someone in your family, or you probably can say, you know someone in my family. In other words, we know each other. When I took this role as public health director, I anticipated tackling such issues as tobacco use, obesity, substance use disorder, and maybe diabetes education to simply help the community that I love. No one anticipated a global pandemic. Nevertheless, here we all are 1.5 years later dealing with this virus. It is the role of public health to keep the public informed and to report data that is submitted to the providers who test. The COVID-19 information that is reported to the state is reported by me and my staff. You know who we are. We are your neighbors. We are your church family. We are your friends. People such as Stephanie Stevie Bentley. She's been a nurse administrator and employee at the health department for over 20 years. Becky Williams, she probably goes to church with many of you. Jimmy Cecil, he's probably refereed one of your children's ball games. These are the people receiving the COVID-19 data, and the information is coming from your local doctors, your hospitals and labs. We are simply reporting the information as it is given to us that's provided by Pikeville Medical Center, ARH Tug Valley, East Kentucky After Hours Clinic, First Care Urgent Care, and others like that. My job as public health director is to provide the public with the facts. And the bottom line is that most of the new cases are coming from the unvaccinated. The few vaccinated breakthrough cases have overwhelmingly been mild, and nearly all severe diseases, hospitalizations, and deaths are attributed to the vaccinated. Every arrow of local and state information points to the safety and efficacy of the COVID-19 vaccines. And those vaccines and what we are seeing locally are reducing severe disease. They're preventing hospitalizations and nearly eradicating death. I would like to now share some of the local numbers that have recently been reported to me and to my staff at the Pike County Health Department that substantiates what I've said today. You can see on chart 1, which is an update of new cases, we currently have 6,361 cases that have been reported to date. 305 of those cases are active. What we're seeing different is how the ages break down with those active cases. 64 of those 305, that's over 20% of the cases, are under the age of 18. Those are school-age children. 39 are in their 20s, 43 in their 30s, 41 in their 40s, 38 in their 50s. Watch how the numbers go down. In the 60s, 26, in the 70s, 24, in the 80s, 8, and in the 90s, 2. On slide 2, you can see the monthly chart, and you can see that in July, we had 339 new cases. This surpassed April, May, June, all of those months. It puts us back really right before we were going into October and fall and holiday activities. So that's where we are today. That's on slide 2. On slide 3, you can see a graph of the weekly cases, and you can watch that bell curve, how we've rolled like a roller coaster over these past few months. And you can see here we go again, and the chart is just showing us going straight up again. The growth is exponential, and it's happening faster than it did last fall. On chart 4, you can see the 7-day average. We look at that when we look at that state heat map that shows whether we're in the red zone or the orange zone or the yellow zone or green. We look at the 7-day average. You can look at our current 7-day average on the left. This is on slide 4, August 4th. We've had 218 cases in the last 7 days. That puts us at a 53.8 per 100,000 daily rate. When you look at the slide on the right, on slide 4, on June 4th, so I just went back a couple of months, we had 17 cases in those 7 days. 17 cases versus 218. Significant difference in a matter of about 8 weeks. On slide 5, this is only showing July 29th through August 4th. You can see a daily number of new cases reported to us. In the red are the vaccinated. In the blue are all cases. Significantly more unvaccinated. 16 unvaccinated out of 23 on the 29th. 15 unvaccinated on July 30th out of 23. 13 out of 18 were unvaccinated on July 31st. On August 1st, 28 out of 34. On August 2nd, 31 out of 40. On August 3rd, 27 out of 36. And on yesterday, August 4th, 36 out of 44. Overwhelmingly, the unvaccinated are our new cases and the more severe, which the doctors can speak on that directly. Chart 6 shows that as a community, we are not where we need to be for vaccination participation. Overall, completely vaccinated, my latest numbers has us at 44.45%. That's fully vaccinated. Please keep in mind that in Pike County, we have a percentage of individuals with comorbidities. We have a high prevalence of the elderly. Those individuals are at higher risk for breakthrough. They maybe didn't get that full immune response from the vaccine. And we aren't even where we need to be in vaccination percentages to begin with. So I wanted to show that chart that you could see that we're only at 44.45% completely vaccinated for our county. That's 25,724 people documented as fully vaccinated. Finally, I wanted to share, we've had a total number of fully vaccinated that were hospitalized, and this is going back only to July 18th. We've had 350 cases reported to us since July 18th, so it's only going back a few weeks. I looked at how many were hospitalized during that time because hospitalizations are going up, and there were 6 hospitalizations from the vaccinated. That's 1.7%. I also looked at where our current cases are. We have 16 current hospitalizations. Now, these are Pike County residents only. It's more like 46 total, but there's 16. And so you want to know the ages of those 16 that are hospitalized. We have an 18-year-old, a 24-year-old, a 27-year-old, a 29-year-old, a 30-year-old, a 55-year-old, 57, 58, 67, 68, 68, 72, 77, 79, 87, and 95. No one under the age of 50 was vaccinated. So this is upsetting, it's concerning. I took this job because I love my community. I'm only up here on behalf of the staff at the Pike County Health Department who've put in decades of experience trying to prevent, promote, and protect. That's our vision, prevent, promote, and protect. They've been doing it for decades. I'm here as their speaker, as their spokesperson, imploring the community to listen to local individuals, our experts who are here today to share more technical scientific data about the vaccines. Thank you.
At this time, I'm going to ask whichever doctor wants to come up first. If you have questions, you can go on the Pike TV Facebook page, put your question on there, and we'll do our best to make sure that one of the doctors or Miss Riley answers that question. Right now is a chance, if you have questions about the vaccine, about something you've seen on social media that gives you concern about the vaccine, please ask the question. We've got 2 people who live here, who are raising their kids here in this community, who are top-notch infectious disease doctors that will answer those questions. And I'm going to say this, I have a 7-year-old that's not vaccinated. And as Tammy said, there's an 18-year-old that's in the hospital right now. I think you're going to hear that the Delta variant, you're seeing younger people a lot sicker than you did when the original strain of COVID came out. And it does concern me because we're getting ready to go back to school, and all these kids that are under 12 have not been eligible for vaccination. And the last thing we want to see is our kids getting sick. So at this time, who wants to go first? I'm going to ask Dr. Ferris Cotter, who is the Chief of Infectious Disease for the ARH Healthcare System, to come up. Doctor.
Good morning, everyone. Thank you, Judge Jones, for the invite. Thank you for the press. Ms. Riley, Dr. Akras, thank you for being here. I'm Dr. Ferris Cotter. I'm the Chief of Infectious Disease for ARH, and I'm also the Chief of Infectious Disease for Mountain Comprehensive Health Corporation, MCHC Clinic. We have 10 clinics across Eastern Kentucky. As you all know, ARH have 10 hospitals in Eastern Kentucky and 2 in Southwest Virginia. I live in Pike County. I've been living here for 10 years. I live 3 miles away from the courthouse. I have 4 kids. They all go to the Pike County schools. They're less than the age of 12. Unfortunately, they're not vaccinated yet. And I belong to this community. I've been in Eastern Kentucky since 2003, and I moved to Pikeville 10 years ago. So thank you for having me here. COVID makes us all meet again every month. So 3 weeks ago, in our system, 12 hospitals, we barely had any patient with COVID-19. We had like 1 or 2. And then suddenly we had 8 cases. So that raised a flag. And in 3 weeks, we went from 8 cases to 77 cases. So that's 10 times in 3 weeks. Currently, we have, as of yesterday morning, 77 patients in the hospitals, 19 in the ICU, 8 on the ventilator, and less than 10% of these patients have had has been vaccinated. So out of the 77 patients in all the hospitals, only 7 has been vaccinated. So 90% plus of the patients we have has not had any vaccine. We had 6 patients, we call them PUI, patient under investigation, that tested not back yet. None of them has been vaccinated. The age of the patients, it's very important. The age of the patients are, 60% of these patients are less than the age of 60 years. We have patients from the age of 20 to 29, 29 to 39, 40 to 49, and 49 to 59. They are the majority of the patients we are seeing in the hospitals right now. In the clinic, it's a different story. Over the last 3 weeks, we've had around 20% positivity rate over 21 days. Before that, we barely had no cases. Around 17% of the patients that we are testing in the clinic and that testing positive are vaccinated. Some have had only 1 dose of the vaccine, but they are doing very well. Most of them have maybe in nasal discharge or they don't feel good, but that's it. So our experience has showed, at least in the last 3 weeks, that the patients who have been vaccinated do well. Yes, they might get to be admitted to the hospital, but most of them do well and get discharged within a few days. What's really sad that we're seeing patients who are sick, and mainly family members, like we have the wife in room A, the husband in room B, and the nephew in room C, and some family members in room D. They all went to the same party together, and they got exposed to a COVID patient, and they got all COVID-19. And we talked to them sometime by FaceTime to do the visit, and they said, "Doc, when can I take my vaccine?" So then I paused. I said, "You know, it's now a little bit too late to take the vaccine, but can I take it? Will it make me feel better?" I said, "Hopefully, if we get you out of this hospital, you do well, in a couple weeks, up to 12 weeks, you can take the vaccine, but right now it's too late." Then comes my question, why didn't you take the vaccine? Well, they said on social media that it hurts and it's not trusted. It might change my DNA. It might have microchips in it. And then we have this discussion that the vaccine does not have any microchips. It does not alter your DNA, nor does it affect your DNA. or do anything that you heard about outside from a medical professional. So I don't want to make this too long, but my message today is clear. If you want to know about the COVID-19 vaccine, talk to your healthcare professional. Talk to the provider who took care of you for years. You trusted that provider for years. He's been taking care of you. You did everything he told you to do. Now when it comes to the COVID-19 vaccine, don't go on social media. You are not getting the right information. Patients deserve to get the right information. When they get the right information, they will consider the vaccine. It's their personal choice. But that personal choice is affected by the information they are hearing. So my plea to you today is if you have question about the vaccine and you have not been vaccinated yet, which we need you to be, talk to your healthcare professional, ask all the questions you have, all the fears you have. You and your healthcare professional make a mutual decision whether to take the vaccine or not. Don't rely on any other information other than what you get from your healthcare professional. And I'm going to leave it up to that. If you guys have any questions, I'll be very happy to answer any questions. Yes. Yes. So I'm going to start from 3 weeks ago. We barely had any patient in the whole system, which is 12 hospitals. And then in 1 week, we had 8 patients. And now, as of yesterday morning, we have 77 patients in the hospital, in all hospitals, 19 in the intensive care unit, and 8 on the ventilator. And most of these patients are very sick. They can't breathe. They have pneumonia. They have fever. And the outcome is unknown. COVID-19 is a very unpredictable disease. Most infectious diseases, we know how the course will be, with few surprises. With COVID-19, we don't know how the course will be. It's a very unpredictable disease. One day the patient's doing well, about to go home tomorrow, and tomorrow they will go into respiratory failure, end up in the ICU, on the ventilator, and sometimes they don't do good at all. It's a very unpredictable disease. But vaccination is predictable. We know the success rate from the vaccine is 95%, and even with the Delta variant that's circulating in the community right now, it's up to 88%. I didn't talk much about the Delta variant, but I can tell you it's the most transmissible virus we've ever seen. It's very efficiently transmitted. One person can infect up to 8 persons, and 1.5 to 2 times hospital admission with the Delta variant, and we're seeing honestly more sick patients with the Delta variant. The only answer to this pandemic and to get out of this is for all of us, including our children, when the vaccine is the FDA approved for their age, 12 and younger, to be vaccinated. And there will be a light by the end of the tunnel.
Question about adolescent child vaccinated.
That's a great question. Vaccines do not impact future fertility. Actually, it has been endorsed by the American College of Obstetric and Gynecology, ACOG, and the Society of Fetal-Maternal Medicine for all pregnant women to get the vaccine. The vaccine does not affect fertility, does not affect conception, and it does not affect the pregnancy. Actually, it will produce immunity to the mom that will pass on to her baby when the baby is born. The baby will carry mom's antibody and be protected for a while. I can tell you about a lot of diseases that I have never seen, and I've been in practice for 17 years. I haven't seen polio. Polio has been eradicated by the vaccine. Nobody talks about polio. Why? Because everybody's vaccinated. You know, I read about smallpox in the books, and I had questions on my exam, but I've never seen smallpox. Smallpox has been eradicated by the vaccine. We barely see any TB. We don't give here TB vaccine, but other countries do. So there are a lot of infectious disease that we learned in the books and we get questions about on our test. And we teach our students and medical students, but we haven't seen why, because of the vaccine. That's a great question, and thank you for asking this. So from the beginning, we said that the vaccine is not 100% effective, right? There is no vaccine in the world that's 100% effective. The COVID-19 vaccines, when they came in, at least the messenger RNA vaccine, the Pfizer and the Moderna, they promised you a 94, 95% effectiveness. So you can still get COVID despite being vaccinated. But then the patients who gets COVID having been vaccinated, they do very well. They will have a sneeze, a cough, maybe a viral syndrome. They don't feel good for a couple of days, but they do well. But most importantly, if you've been vaccinated, vaccine prevents severe disease, hospital admission, ICU admission, being on the ventilator, and most probably mortality. So the vaccine prevents severe disease. Even if you get COVID having been vaccinated, it's possible, it's a small chance, very small. I told you 10% of the hospital admissions and maybe 13% to 17% as outpatient. But vaccinated people or patients do very well. Any other questions? Less than 12. They're 9.5 and 7.5. Yeah? You know, I'm a man who follows science, so is my colleagues here. We have to see these numbers. I don't believe them. But I can tell you from our system, you know, we have 6,000 employees in the ARH, and in Mountain Comp we have 400. I'll tell you that our vaccination rate in the clinic and the hospital is around 70%, but you know 98% of our physicians have been vaccinated, 98%. So I'm not sure about where the 55% came from. However, for the vaccination rate for kids, right now the vaccine is approved, FDA approved for 12 and older, at least the Pfizer vaccine is. The next category is going to be 12 and younger, and that's coming. I expect the vaccine to be approved for kids younger than 12 by midwinter. So as of today, anybody above the age of 12 can get the vaccine. And what's coming next is kids under the age of 12. Hopefully the vaccine will be available for them by midwinter.
And I think you said that your youngest two are not eligible for the vaccine yet. Is that correct?
They're not. They're not eligible for the vaccine, and that worries me because you know they're going to school soon, and most probably they will have their masks on.
All right, Doctor, thank you very much, and we'll go ahead and let me introduce Dr. Fadi. The next person I want to ask to come up is a man that this community owes a tremendous debt of gratitude to. I don't think that the public really understands what Dr. Fadi and Dr. Cotter have seen. You know, if you don't know somebody or you've not had a loved one go through this, I personally know 3 people who've died of COVID. I know some other people. We've had 2 county employees that were hospitalized that were extremely sick. But I think that it would be very important for somebody who's been over there taking care of the sickest people in our community to tell you exactly what he sees when these people come in, they're in the ICU. He's going to tell you what an ECMO is. May not know what that is. But you know, it's easy to second guess this or to downplay it unless you've seen it firsthand. And you know, this community, and again, they owe Dr. Cotter and Dr. Fadi a tremendous debt of gratitude, but Dr. Fadi has gone above and beyond more than any other physician that I know in Eastern Kentucky, in this community in particular, to educate the people of Pike County and to take care of the people who get this virus. And on behalf of the fiscal court and the people of the county, thank you. And you've been a godsend to the people who've had this virus here, and it's much appreciated. Doctor, come on up.
Appreciate you, Judge, for these kind words, and thank you, Tommy, for wonderful presentation. Dr. Ferris did basically a great presentation focusing on the severity of these cases here in the community. And again, our goal of all these press conferences, as usual, is to bring scientific information. So that's basically our goal. We're bringing medical science, not political science here. And that's been the strength of our presentations since the beginning. And our goal as well is to send awareness to the public and empower them with information. If we empower them, at least they can do their part. I'll be focusing during my part on the Delta variant and what does it mean for the vaccinated and unvaccinated people. I think everybody has interest in that topic. So as you know, there is fairly clear evidence that the Delta variant is more contagious than the other versions of the COVID-19. And unfortunately, we have seen a spike and uptake recently in all hospitals across the region, the state, as well as in the United States. And the problem with the Delta variant is very contagious. So it's at least 2 times more contagious than any version, and it spreads so fast. And this is basically the tricky and disturbing part of the Delta variant. So it can infect more people in short period of time. And all the studies currently showing that that virus can multiply in our inlyings, in the upper respiratory, as well as in the deep respiratory system, very fast, leading to high quantity of the virus. And that's why it's so contagious, so transmissible, can go from one person to another person in a very short period of time, and could be as well more pathogenic. So can lead to more severity and more bad illness, leading to people to go to the hospital. So the bottom line is that variant has the ability to infect more people over a short period of time. And again, this is very alarming. We are seeing currently a sharp rise in the number of hospitalizations coming to Pikeville Medical Center, as well to the ICU admissions. And I'm going to talk about several observations from the numbers I'm going to show you just in a second. And at Pikeville Medical Center, we moved from 3 cases on June the 3rd to currently 31 cases of COVID-19 in the hospital. And this is definitely not fun. This is very alarming for everybody. So patients admitted to the hospital are currently sicker. Number 2, younger. We've seen patients 18 years old, 29 years old. And I'm going to talk about the numbers that the majority of these cases are less than 65 years of age. We haven't seen that during the first spike. So this is a new observation that we are battling with at this point. And mainly, most of these admitted people are unvaccinated. And I'm going to cover that. And there's a huge difference as well in the number of vaccinated and unvaccinated on the floor versus the ICU, because almost the majority of cases are currently in our ICU are unvaccinated. 11 out of 12 did not receive the vaccine. And we're going to talk about the severity of these cases. 7 of them on mechanical ventilation, 3 on ECMO, and this is extracorporeal membrane oxygenation. This is a machine that you pull all the blood out, and you oxygenate the blood and put it back again to the person. And this is definitely last resort for somebody having and battling very bad infection of the lung. We call it pulmonary infection from COVID-19, and this is the only way to be able to keep them alive. We have 2 more we call them non-invasive ventilation. We put the BiPAP, we put high-flow oxygen. So we are seeing these cases now very often, and this is something we haven't seen it before. So more than 1/3 of our cases are in the ICU, and this is something we don't like to deal with and we don't like to see. So if you do, as well as I mentioned, deep diving into the age, the median age of our people coming to the hospital is 66, but we are seeing younger folks, 18, 24, 42, 48, 51, 52, 62. So if you look at the floor with COVID patients, 5 of them are fully vaccinated out of the 19. But if you look in the ICU, you have only 1 fully vaccinated after the 12. And this is indirectly a message that people vaccinated can survive better compared to people unvaccinated. So this is something basically I want to send to the public, that the vaccines are extremely effective and protective and can save lives. So the longer we allow the virus to circulate in our communities, the more we're going to hear about variants, or we call them mutants. And this is something we don't like to hear about. But unfortunately, they circulate at high speed. There is always a chance, unfortunately, that these variants may evade the immunity from vaccination. We hear about the Delta, and we're going to hear probably in the future about Delta Plus. And all these mutations may create some problems and barriers in the way of normalcy. We don't want that. The job of these viruses as I had probably an article just recently talking about these viruses, they mutate all the time. This is their job. They want to basically change and mutate to fit and to overcome pressure. Unfortunately, doing this may create problems. They may evade immunity, may create more problem with transmissibility. They can create more problem, causing more diseases and more severity of the illness, putting patients in the hospitals. So we don't want to see that. We have to put an end to this crisis, and this is definitely feasible. COVID-19 vaccines are currently the best weapons we have in our arsenal to curtail this pandemic. And the best way to have our hands wrapped around the crisis is by massive vaccination. We need to reach the 70% and over herd immunity. And the best way to do it is through vaccination. Vaccination is safer than natural immunity, and we have some study telling us that it can last longer. So protection from vaccination can last longer, and this is a way safer option than having natural immunity, because nobody knows exactly what's going to happen if you contract COVID-19. As Dr. Ferris said, this is very unpredictable. Some people, unfortunately, can go to the ICU, can suffer death, and some people, they do just fine or have no symptoms. So it's very disturbing about the symptomatology of COVID-19, because nobody can predict what's going to happen in the future from COVID-19. So people who are fully vaccinated with no major comorbidity, they should do well. We have studies telling us 95% for the Pfizer, 94% for Moderna to prevent infection. Unfortunately, not everybody is going to do perfectly well, because all depends on the age and comorbidities. Some people, they cannot respond fully well. They cannot mount great immunity. And that's why you see some infection down the road. And this is so predictable. This is not a perfect vaccine, but do not let the perfect be the enemy of the good, especially when the good is outstanding. These vaccines are doing their job. And I'm going to talk about the job of these vaccines just in a second. So they prevent cases of COVID-19, especially the bad cases, the cases that will bring people to the hospitals. They prevent bad hospitalization, and they prevent death. This is what we're expecting from the vaccine to do. Don't get drifted that we need a perfect 100% vaccine. This is not going to happen. So let's focus on what's important and how to prevent the severity and the bad cases of COVID-19. Let's basically prevent people from going to the hospital, and most importantly, dying because of COVID-19. In my opinion, this is a tragedy to see cases coming to the hospital when these problems could be prevented by inoculating the vaccine in the arms. The vaccines are extremely powerful and effective, but they're not going to work in the fridges. They need to be pushed in the arms, in the muscles, in the body, to train the immune system and produce what's called antibody immunity and cellular immunity. So even if you contract the infection, your body is so prepared. So you have this immune system already active to take the fight against COVID-19. And that's what we need. Even if you have symptoms, which can happen, but you still be protected against the drastic consequences of COVID-19. And this is something I want to basically send to the public, that yes, that's what we need to be able to stop this crisis. Now, we have, unfortunately, some data telling us that vaccinated people, especially with the Delta variant, can harbor the virus with high quantities of viral load in the nasal and respiratory mucosa as the unvaccinated. And that's why if you see the CDC like coming back a little bit about tweaking the guideline about having the vaccinated people masking up in indoors, especially in confined places, when you have a lot of transmission, and here high transmission, which means 50 cases per 100,000 people, and this is something we have here in our area. If you look at the map in Kentucky, unfortunately, we are changing color constantly. Currently, almost the map is red, and this is something we don't like to see. We like to go back to green. We like to go back to normal, and the only way to do it is by massive vaccination, and this is something we need to accept. We need to be part of the solution. All of us should be part of the solution. If we don't do that, we cannot reach normalcy. So the fastest way and the safest way to do so is through vaccination. Let's be clear and honest with that. There is no way for us to go through normalcy except through vaccination. And if you want to quit hearing about the variants, the best way to do it is by getting the vaccine. So please consider that. Consider solutions here. Consider being part of the solution here for the area and for the region and for the state and for the whole United States. Let's be able to do that and keep rolling and do our part. Let me talk a little bit about the severity of the cases as well, because, again, this is so disrupting to see young people as well, people dying from COVID. And I hate to be the last person holding hands for people dying before the family members will see them. This is something we don't like to do. We don't like to see. We don't like to experience. This is heartbreaking and so emotional to see somebody passing and you're the last person, healthcare professional, last person touching that person before dying. So think about it, do your math, look at good scientific evidence, and consider vaccination as absolutely the safest option to go back to normalcy. So we have several studies, if somebody concerned about Delta variant, several studies from the Pfizer that if you take the vaccine, and again here the vaccine, you have to be fully vaccinated. One vaccine doesn't mean nothing. You are partially protected. If you look at the New England Journal of Medicine study that you need the 2 shots of the Pfizer vaccine to produce 88% effectiveness. But if you take only 1 shot, you're already generating only 30% immunity and protection. And this is not sufficient. Okay, so we need to maximize our protection, and we need to follow the guidelines and recommendations when it comes to the vaccination. So 2 shots to be fully vaccinated, and you have to wait 2 weeks after the 2nd shot to achieve that level of protection. Again, 1 shot is not sufficient. If you want to take Johnson & Johnson, yes, that's fine. 1 shot should be enough, and you have to wait for 2 weeks after that. All these authorized, emergency use authorized vaccines are perfectly the solution now to be able to stop the crisis. So there are several also studies as well from India that comparing people vaccinated versus unvaccinated, especially for the Delta variant. People who are unvaccinated, they have double the risk of mortality compared to the vaccinated folks coming to the hospital, 3.5% versus 1.5%. And this is definitely a remarkable change in the mortality rate. And the results also showed that if you're already partially vaccinated, so you're taking only 1 shot, your mortality is going to be almost as equal as the unvaccinated people. So this is also another message that if you want to get vaccinated, please complete the full vaccination. And again, one more time, this is going to be the safest way to be able to finish that crisis and stop that raging virus from mutating and proliferating and stop people from having bad outcomes from COVID-19. So please, please vaccinate and do not hesitate.
Doctor, let me ask a few questions. First and foremost, there's been a couple questions about what the long-term side effects of the vaccine are for both adults and adolescents.
So side effects of the vaccine, of the COVID-19 vaccine, are not different from any other vaccine. So you have the needle injection in the muscle that can cause some soreness, some redness, some fever, some chills, and these signs sometimes are equivalent to immune reactions. So your body should react to it. So the vaccine is pushing what's called foreign body or antigen to make your immune system reacting to it, developing immunity, humoral immunity or antibody immunity and cellular immunity or memory cells to be able to fight the fight once you contract COVID-19. So these side effects are normal findings that you encounter with any vaccine. They last mainly 2 days to 3 days. Most of them are mild. We rarely see what's called serious side effects. So anaphylactic reaction, I think 2 to 5 cases per 1,000,000. If we're talking even about thrombosis and thrombocytopenia from Johnson & Johnson, we're talking about 7 cases per 1,000,000. So we're talking about very rare incidences from the vaccine that you may encounter as well from other vaccines. So my message here, this is a small toll compared to the gravity of the natural infection from COVID-19.
One of the other issues is just technically we're having some problems with the streaming. We've got a lot of different media outlets here today trying to stream this. If you can't get this live on Facebook, either on WSAZ, WYMT, Pike TV, or Mountaintop News, I'm sure the Appalachian News Express is going to be covering this. There'll be an article. They'll have an article on their Facebook page. And also, Pike TV and Mountaintop News will have this entire press conference in its entirety on their Facebook pages. So let me ask a couple other questions. If someone watches this, they make a decision based on everything that they've learned, whether you disagree with it or anybody else may disagree with that decision not to get vaccinated. 2 questions. One, if they choose not to get vaccinated, what can they do to avoid getting the virus? And two, what are the risks that they run if they do catch this Delta variant?
I'm going to start with that to be able to put an end to this crisis, we need to achieve a herd immunity of 7% and more. And you have two ways to do so, either by vaccination or by natural immunity. So it's up to you to make that choice. Vaccination is a way safer process compared to natural immunity because natural immunity is very painful. Unfortunately, we have the post-Holler syndrome. We have the complication from COVID-19. You can go to the hospital. You can suffer what's called the severe COVID-19 pneumonitis. You can be on the ventilator. Unfortunately, you can die from that. So these are the only two ways to be able to achieve herd immunity and to be able to stop the crisis. And we recommend vaccination with natural immunity for several reasons, because it's easier to do so, safest process to do so, and it's very effective because we have some study telling us even if you got natural infection, 30% of folks, they have no immunity. So that immunity is so variable, and there is no guarantees as well that this immunity from the old infection will provide some sort of immunity to the variants. So that's what we asking people, even if you're young, even if you're healthy, even if you had the previous infection, please get vaccinated. This is gonna be the safest option to overcome this crisis. So we need to curtail this pandemic. It's been basically lingering for a long time, and let's be very honest with that. There is no way for us to eradicate COVID-19. We're gonna live with it. The only way we can do here, we can tame that raging virus. And the only way to tame it is by vaccination. So let's be all part of the solution and try to help our communities and our state and our country, and let's achieve the herd immunity by mainly vaccination. Now, if you opt to not use vaccination, you have to keep using mitigation measures. This is the CDC guideline. If you're not vaccinated and not immune, you have to continue to mask, social distancing, wash your hands frequently. So this is gonna be the only options to protect you from having the infection. But one more time, the safest and the quickest path to normalcy is gonna be through vaccination.
One question was, are there side effects to the vaccine, like sterility? I think you've already talked about the fact that the vaccine's not going to impact someone's ability to conceive a child. But is there a concern about anything from like liver damage, heart problems, anything like that?
It's been almost a year now since the rollout of the vaccine, and if you look at the CDC website regarding all the side effects, you can see that the majority of side effects are predictable. We're talking about the fever, the chills, the muscle ache, the side pain. In addition, sometimes a little bit of like GI symptoms, so very mild side effect. The serious side effects are very, very, very low. And that's why I'm saying the vaccine is very safe. All the authorized vaccines for COVID-19 in the United States are extremely safe. And again, going back to the sterility part, all the societies, including CDC, are endorsing the COVID-19. There is no data so far to tell us that the vaccine can cause sterility. And people that say it's going to your blueprints, this is not true, because the messenger RNA in specifically doesn't reach your nucleic cells. So it doesn't go inside the nucleus and doesn't touch the blueprint, or we call them DNA. It stays in the cytoplasm, and everything is going to be cooked up in the cytoplasm. So that concept is absolutely wrong, and this is all misconception regarding sterility and attacking your nucleic acid materials.
Now, let me ask you this. Is the Johnson & Johnson what's referred to as an mRNA vaccine, or is
This is basically viral vector vaccine, which is different. This is mainly DNA. So this is different, slightly different concept from the messenger RNA and the Johnson & Johnson. Yes, it goes to the nucleus. You need to fabricate the messenger RNA to be going again to the cytoplasm and fabricate what's called the proteins responsible for boosting the immune system.
We had a question from someone who had the Johnson & Johnson vaccine as to whether they might need an mRNA vaccine in addition to that.
This is a good question. Basically, that option is currently on the table regarding having a third shot for the messenger RNA or second booster for the Johnson & Johnson. But all the guidelines at this point are not recommending any booster beyond what's recommended by the FDA. So in the future, you may hear about having probably older folks, 65 and older, people with some sort of immunocompromised status may have a third shot because they don't have good immunity to develop after second shot, and sometimes you need to push a second one or third one, and this is basically something still in the development, in the process of studying to be able to figure if it's going to be applied or not. But there is no guidelines at this point to give a third shot for the Pfizer or Moderna or a messenger RNA for the Johnson & Johnson.
But you think it's possible that there will be a booster shot needed?
Again, we need more scientific evidence to show the benefit of that, because we don't want to mix something that may cause some harm. So all will be based on scientific evidence.
One other question, I think it was already touched on, just briefly, if you've been vaccinated, again, how can you still get it?
Absolutely, because again, we're talking about every host or everybody is different. So people like 65 and older is having some sort of immunocompromised status. They're getting chemotherapy. They're getting some sort of what we call TNF alpha because of rheumatological disease. They don't have robust immune system. They don't have that. So what you do here, you try to stimulate the immune system, and the production of immunity is not sufficient to protect them. So that's why we see the 5%, 10% among vaccinated people still having the infection. So this is definitely a possibility. And the problem here, we are so blessed in the United States to have ample amount of vaccine. This is something I want to stress on. The rest of the world is still battling to have at least one shot. And here, unfortunately, we are wasting the vaccine. So let's think about it this way as well. Vaccines are very effective, and a lot of people are asking for it when we have too much supply compared to the demand.
The other question is, how many people have you treated for COVID-19 at Pikeville Medical Center that have passed away as a result of COVID? Now, there's a lot of information out there. People say, well, they may have had COVID, but they died of something else. COVID wasn't the cause of death. How do you respond to that? How many people have you personally treated who have died from COVID-19?
I don't know exactly what the number, but definitely hundreds of patients died because of COVID-19. And I will say that definitely from COVID-19, because COVID-19 is an inflammatory disease by excellence. It's not only about the infection, it's about what's going to happen after the infection. It's about the ramifications of these infections, from clotting in the lungs, clotting in the legs, clotting in the heart, from having other problems, myocarditis, pericarditis, acute coronary syndrome. So the COVID-19 is not only impacting your upper airways, it's going to impact your lungs, it's going to scar up these lungs. You cannot breathe. So this will lead even to more complications down the roads, like septic shock, multi-organ failure. Yes, definitely COVID-19 can kill people. And I know people that questioning if COVID-19 can kill. Yes, even on the certificate, we can say COVID-19 is killing these folks because these are the only problem they've been having and leading to that kind of death.
This is a personal question.
Yes, sir.
And I'm going to ask it. It's not something somebody sent in. What's it been like on you personally to have to deal with people here in the community? I'm sure some of them you've known that you've had to treat who haven't survived COVID-19.
This is very emotional, periods for the last year and a half. I think all healthcare professionals been on the front line, been battling with that. And we've seen, unfortunately, these people isolated in rooms. These people, they having more emotional and more psychological problems than the disease by itself. They cannot go outside the room. They cannot have anybody to come and talk to them. The only time they talk to people through virtual or through phones. So this is definitely not a pleasant experience for the patients, and it's not a pleasant experience as well for us. And again, I'm going to reiterate on what I said earlier. This is an absolute tragedy to have people in the hospital when could this be prevented easily by vaccination. So please, please do your search. Look at reliable information and try to get the information from there. Vaccination is the safest process. Vaccination can save lives. Vaccination can prevent severe disease. Vaccination can prevent what's called the long haulers. We have people even surviving from the COVID-19 from the hospital. They're suffering the fogginess, the fatigue, the chronic respiratory distress. So they're having poor quality of life. And this could be easily prevented by getting the vaccine. So think about it. Do not hesitate and vaccinate. This is going to be my constant message through our county, through our hospitals, and through that community. So let's push for the vaccine. Let's do what's best for the community. Sometimes it's very hard to make the right decision because it's hard. So the right decision is always hard, but vaccine is the best and the safest option at this point.
Before we turn it over to the audience, what do patients go through when they're in a terminal phase of COVID-19? And Dr. Cotter may want to talk about this too.
Yeah, he
I
can.
mean, whichever one or both of you can come up. But what happens to these people? I mean, what do they go through? What do they experience? I mean,
You can see the depression and the psychological pressure on them easily from their eyes. From the look of their eyes, you can see how depressed they are. They are suffering deadly disease with a lot of unknown. It's unpredictable. They cannot know exactly what's going to happen in the next few days. They don't know if they're going to leave the hospital or not. They don't know if they're going to be on mechanical ventilation or not. They don't know if they're going to die or not. They don't know if they're going to see their family members in the next few weeks or not. So these are very, very disturbing questions for them, putting them down. And not only we're battling with the disease by itself, we're dealing with the psychological aspect of the disease. So this is something can be prevented. And I want the public to be aware of that.
Dr. Cotter?
So you asked me how does it feel like by the end of life for these patients. I'm going to be blunt and excuse me, it's a very miserable death, very miserable. The patients are in a room by themselves, they can't see family members, they can't talk to them on the iPad or the iPhone. They're losing the capacity to breathe and they know they are dying and there's nobody around them. And for a physician like me, I look at the chest x-ray, it's white, there's no air, it's infection. I've given the patient every medication and therapeutics I have, and there's nothing else I can do. I just watch the x-ray, watch the patient, and go back home. On my drive back home, have a long drive, I think about it. Then in the morning is the same story again. Multiply this by 10 patient, 20 patient, 70 patient. So it's a very miserable end of life. And it's nothing that no one of us wants to go through or see family members or friends or people you know in the community, especially personally, go through. One way to avoid this, prevent this, is get vaccinated.
All right, thank you.
Thank you.
We'll open it up to questions from the press or anybody here in the audience.
So the mandate came yesterday, as you know. The majority of healthcare workers have been vaccinated so far. There's only a small percentage that have not been vaccinated, and there will be. In a hospital, you want a healthy environment and a safe environment for our patient and our staff. We have seen entire departments in our hospitals go from, I'm talking about healthcare people, going from no infection to the whole department being infected from one employee. So the lead thing as a patient in the hospital coming to have a gallbladder surgery, get exposed to an unvaccinated employee who is infected by COVID-19 and doesn't know it. So in order to promote a healthy environment and a healthy situation for our patient and our healthcare, that is the best way to go. Actually, there have been more than ARH and UK Healthcare. There have been at least 10 hospitals in Kentucky that have adopted that strategy. And yes, I am in perfect support for it. Again, vaccination, including healthcare workers. We should be leading by example.
Can I add to this quickly? From PMC standpoint, our CEO and president basically working diligently with all the partners in the area. So we're working very carefully on the well-being of the community for the healthcare workers as well as for the safety of patients. So I'm not going to elaborate more. There's going to be an announcement by the governor at 12:30, by the CEOs, CMOs, as well as Dr. Stagg. So I'll let them basically release that information. So I'm not going to allow myself to release anything about that. So listen from them at 12:30. It's going to be announced very shortly. Yeah.
All right, any other questions?
That's countywide, so I guess anyone could answer really. But with less than 45% of the population vaccinated and school returning, what do you expect to see in the coming weeks and months?
So this question for Dan.
Yeah. A good one, Buddy. Okay, so when you asked that question, Buddy, about what we anticipate for the upcoming weeks in our schools, could you repeat that question again? With the vaccination percentages where we are now, which is 44.45%, very few of that 44.45% is under the age of 18. So those numbers are very low. So what we know is that those who are eligible, just the 12 to 17, and really it was the 12 to 15. Pfizer had 16 years of age and up from the beginning. The amended, the expansion on the amendment for the Pfizer EAU included 12 to 15-year-olds. So 16, 17-year-olds had the ability to vaccinate from the beginning back in mid-December. So, you know, that's a local jurisdictional decision that superintendents and their local boards are going to need to make as far as what their recommendations and what they're going to recommend and what they're going to mandate. Clearly, from a public health perspective and what I see with the growth of numbers very likely attributed to variants in the county. I know we do have documented Delta variant in this county. It is documented, so we know it's here. I mean, I think any expert, and it maybe wouldn't take an expert to look at that and know that when those children go back to school, very few vaccinated in the classroom, that it's going to spread. Those numbers are going to go up. So it's quite concerning because what we're seeing is that younger individuals in the hospital, younger individuals who are experiencing more severe disease than what we were seeing before. So it's quite concerning, and you know, you could certainly make the leap in that it's good common sense that those numbers are going to grow.
Tammy, I have a question. This is coming from the judge. Being the parent of a 7-year-old little boy that's, of course, unvaccinated, what risk do you think that he's taking? What risk am I taking? What risk is his mom taking by putting him back in a classroom being unvaccinated? Or if one of the doctors want to mention that. I mean, I know that by and large, kids haven't gotten as sick as adults, but then you do see reports of younger children getting severe disease or dying. I don't know if Dr. Cotter's taking his mask off, if he wants to address that. Or
I know he mentioned that his children would be masked because they're under the age of eligibility for vaccination. You know, my child that's in junior high who was eligible is vaccinated. I've spoken with all the pediatricians in Pike County. We did a massive pediatric Don't Hesitate, Vaccinate campaign. They were all in support of their children being vaccinated, but for those children who are unable to vaccinate without a mask in a closed setting, there is risk. Overall, the younger children have done better to date. We are seeing some more severe illness with younger individuals, but I would be quite concerned sending an unvaccinated child into the classroom unmasked. I'll let them elaborate.
They can chime in on this. You know, as a parent, my kids are going to school soon, and they're not vaccinated yet. They're not 12 years of age. With masking and vaccination of all the kids in school, 12 and older for now, and vaccinated teachers as well, it should be a safe environment. You're going to have a case now and there, but with universal masking and mitigation efforts, that question about what can I do if I choose not to take the vaccine, right? Masking, social distancing, and hand washing, along with the other kids in school who are eligible to the vaccine to get vaccinated, and teachers being vaccinated as well, it should be a safe environment until the vaccine is approved for kids 12 and younger, and hopefully by mid-winter.
do you expect, or are Pfizer and Moderna in the process of obtaining full FDA use authorization?
Yes. There is a study going on right now, and it should be soon to get the emergency use authorization for the Pfizer vaccine for kids 12 and younger. And I know Moderna has a pediatric study as well.
What about the lifting of the emergency use authorization for Pfizer and Moderna and getting regular FDA authorization?
It's not soon enough, but yes, we do need that. We need the vaccine to go from emergency use authorization to FDA full approval. It should be soon for the Pfizer vaccine, and it should be also soon, hopefully, for the Moderna vaccine for adults.
Any other questions?
This is coming from someone who has actually come across misinformation on how the Delta variant is decided, or how they can decide how someone has a Delta variant. As if some people have reached out to doctors or medical institutions, and some have even said, we don't know. How is that decided to allow people a better understanding of how someone may have or may not have the Delta variant?
So it is estimated right now that 83% of the virus circulating in the whole country, in the whole United States, is the Delta variant. And that including, our state and our community. If you want to pinpoint the Delta variant, you can send the virus for sequencing and detection of the mutation that the Delta variant has and able to identify the Delta variant. But honestly, for me as a healthcare professional, it doesn't matter if it's the Delta variant or the Alpha variant. The treatment is the same, and the message is still the same: get vaccinated, whether it's a Delta variant, Alpha variant, or another variant. Any other questions? Yeah, go ahead.
I receive actual reports from the state epidemiologist regarding Delta variant identification. So I actually see those numbers for Pike County only. Keep that in mind. But what I'm seeing and hearing at the state level is that there's a very low number of samples that are being sequenced specifically for the variant. Now we're ramping up, and I think that those numbers will go up. But currently, there's about 4% of the samples as they're sent either to the state lab or to a lab that there's a few in the state that are sequencing. So in the state of Kentucky, it's around 4% of those samples that are sent for sequencing. So even at that small percentage of samples, and we know we've seen some Delta variant in those, that's very telling that we know that it's here. But I've seen a lot of that on the media talk from individuals that are in the county or in the community, the Eastern Kentucky community, that they had the Delta variant. And in all likelihood, very few people probably know which variant that they have. I mean, the Alpha variant was certainly the leading variant early on when we saw that surge back in December and January. And in all likelihood, from a public health perspective, we're certainly dealing with the Delta variant now, how we're watching how quickly that the numbers are rising. But only about 4% of the samples at the state level are sequenced, so we only see very few. When you're going to, do a drive-through for a COVID swab, or to an after-hours urgent care center, your local provider sends it off. In all likelihood, individuals are not receiving that information that's reported from the state epidemiologist down to public health. So I wanted to clarify that. When you hear that, many times there's some misunderstanding.
Most of the sample that we send for the variant for the sequencing is mainly for breakthrough cases. Correct me if I'm wrong. So that's why we do mainly for the breakthrough cases. Going back to your point, you basically made this wonderful statement about how do we know. There is no true surveillance studies head-to-head to tell me which one is getting this variant and which one getting the other variants. But based on the severity of the disease that we are seeing now, we believe that that variant is contributing to most of them. So this is basically the most simplistic answer I can basically provide you. But more of the sequences, 4%, so low percentage, and the majority of them on the breakthrough cases, we don't have truly ample data on people who are not in the hospital. So it could be more than that. Could be 80%, could be 9%, I don't know. But we can say for sure, just from the severity of the cases that we see in the hospital, then the Delta variant is putting more pressure on the healthcare system.
Anything else? Just briefly, I want to thank everyone for tuning in. We want to thank all the folks who are here today because we do care about the people of our community. We're not telling you or mandating have a vaccination. We're just trying to educate the public on what's true and what's not true. And there's so much misinformation out there. You know, instead of listening to something on Facebook, I'm going to listen to the two doctors that if it happens to me or a member of my family that I'm going to be looking to save their life or my life, I'm going to listen to them before I listen to something on YouTube or Facebook. And if you choose not to get a vaccine, follow their advice. Wear your mask, avoid indoor crowds, make sure you take all steps that we were taking, you know, before the vaccines to try to avoid catching this disease. Again, thanks to everyone for being here. I hope that this is the last press conference, but the direction we're moving is about where we were last September. And we know from September going from 200 or 300, 400 cases, October it started to spike, and we hit almost 2,000 cases. In January we hit almost 2,000 cases, and we're on that same trajectory. And, you know, on behalf of our healthcare providers, we first of all owe them a tremendous debt of gratitude. But, you know, these two gentlemen and all the employees at ARH and PMC, you know, Ms. Fabian Little's, our road supervisor's daughter's a nurse at PMC. Greg Fannon's daughter's a nurse at PMC. Commissioner Ronnie Robertson's wife's a nurse at PMC. Reggie Hickman's wife is one of the longtime, she's director of compliance, but she's a longtime, was chief of nursing at PMC. All of our healthcare providers, every time that they're exposed to a COVID patient, they're putting their lives on the line too. And we do owe them a tremendous debt of gratitude. So at this time, we'll conclude the press conference, and if there are any significant changes, we will be having another press conference. I was hoping that we wouldn't have to do this, but with the increase, I felt it was important as the county judge executive on behalf of the members of the fiscal court. We're not here to mandate or browbeat people. We just want people to know what the truth is and what the current situation is. We're a long way from being out of this situation with the virus. You know, some people said, well, after the last election, it'll be, you know, the virus will go away. It's not. And people are still dying and people are still getting really sick from it. And like I said, I've lost 3 friends to COVID-19. 2 of them really didn't have any health problems. And it's something that you don't want to see happen to anybody. And we want this thing to get it back under control so we can have some level of normalcy. But again, thank you for tuning in. If you are watching this live, the full broadcast will be available on Mountaintop News and on Pike TV on their Facebook pages. We want to thank all the members of the press, WSAZ, Appalachian News Express, and WYMT for being here. Thank you all very much.